Okay, so we are recording this session, and you'll also see up on the top left-hand side, there may be a little banner that says live on Zoom with Rev.com. That is indicating that we are offering closed captioning services, and you should be able to access that down at the bottom of your screen. It will either say closed captionings, or you can click on the more button and it will come up there if you need them. And let's see. All right. Thank you all for joining us today for our MedlinePlus training. We have Roz McConnaughy from the University of South Carolina's Library of Medicine with us to lead the presentation. Many of you are involved with us in the Network of National Libraries of Medicine grant partnership that we have going on, and I appreciate you joining us today. I will send you your gold star stickers in the mail. Wendy sends me gold stars regularly, so I always appreciate getting them. I'm Rebecca Ansel. I'm the Youth Services Consultant. We've got a couple other state library folks on with us today, but I am going to go ahead and turn things over to Roz.
Okay, good afternoon, everybody. Like Rebecca mentioned, I'm from the University of South Carolina School of Medicine Library, and today we're going to be taking a look at one of my favorite websites, MedlinePlus. Since I'm a medical librarian, friends and family will reach out to me when they get a new diagnosis or getting a procedure and they're looking for more information, and MedlinePlus is my go-to site to share with family and friends. So our objectives for this session, by the end of the session, you'll be able to define health literacy and access quality health information content from MedlinePlus. And during this session, we'll take multiple breaks from listening to me talk, and I'll ask you to go live to MedlinePlus and find some answers to some scavenger hunt questions. So before we dive into MedlinePlus, let's take a step back and look at health literacy. So what is health literacy? Here's a definition from the National Library of Medicine. Health literacy refers to how well a person can find and understand the health information and the services that they need. It is also about using the information and services to make good health decisions. So what are some of the skills that are needed for health literacy? You need to be able to access healthcare services, communicate with your healthcare providers, locate health information, then evaluate that information for credibility and for quality. Sometimes you'll need to be able to analyze relative risks and benefits, calculate dosages, and interpret test results. So patients are often faced with complex information and treatment decisions. Oops. So health literacy affects everybody. So it's important for everyone because at some point in our lives, we all need to be able to find, understand, and use health information and services. And according to the CDC, health literacy can help us prevent health problems and protect our health, as well as better manage those problems and unexpected situations that happen. And taking care of our health is part of our everyday life, not just when we have to go visit a doctor or a hospital. So even people who read well and are comfortable using numbers can face health literacy issues when they aren't familiar with medical terms or how their bodies work, if they have to interpret statistics and evaluate risks, like when they may be offered a procedure or a surgery, if they're diagnosed with a serious illness and they're scared and confused, and when they have health conditions that require complicated self-care. And since I work at a medical school, I'm on committees with doctors and other healthcare professionals, and I wanted to share this story with you guys because even if you have high health literacy and know a lot about medicine, you can still have health literacy issues. Well, over the summer, I was in a committee about developing health economic information in the medical student curriculum. And during the meeting, one of the doctors admitted that he doesn't even fully understand those health insurance bills that he gets in the mail. So, you know, a lot of people can struggle with health literacy, different health literacy skills. So while our patrons are out Googling for health information, they may stumble across medical misinformation or misleading information. And this can happen on social media sites too. Like my son's pediatrician likes to joke, everything on Facebook is true, right? Well, here are some statistics. 68% of American adults at least occasionally get news from social media. But one of the more positive statistics that I found was that 57%, so the majority, say they expect the news they see on social media to be largely inaccurate. And this data comes from a Pew Research Center study that was done in 2018. So at least they're thinking critically about what they're finding, or the majority of people are. Although I do have an aunt that is a recent new Facebook user, and she comes across all kinds of posts that she will share with me, and can you believe this? And so having to do some debunking and try to show her some other more authoritative sites to get health information. So which sites are most popular for news? 43% of folks said that they get news on Facebook, and 21% get news via YouTube. So those were the two highest social media sites that people were using as far as news. So I wanted to share a couple of research studies that looked at the quality of health news on social media platforms. In the summer of 2016, some researchers looked at the accuracy of Zika virus information being shared on Facebook. And they looked for the quality, credibility, and popularity of posts on Facebook related to Zika virus. And while there was quality content from the CDC and the World Health Organization being shared, the most popular posts were the misleading conspiracy theory kind of posts, where researchers the researchers stated that this kind of diluted the accurate, relevant public health information that was trying to be posted about the disease. They found that the most popular useful post from the World Health Organization was viewed 43,000 times with 964 shares. But then they compared it to the most popular misleading post, which was 10 Reasons Why Zika Virus Fear is a Fraudulent Medical Hoax video. That was viewed 530,000 times with 19,600 shares. So they realized people were quickly sharing this information and not really evaluating the content before they click that like button. So popularity does not equal quality on social media and many websites. And information dissemination is vital during times of public health crisis, like our situation today with the COVID-19 pandemic. And social media can be a good way to get out health information news, as long as it's not being drowned out by the misinformation out there. In 2019, some researchers from New York University studied the quality of information about prostate cancer videos on YouTube. And they found that 77% of the videos included in their study contained poor quality information or biased content within the video or comment section, with a total reach of 6 million viewers. So just because a video gets a lot of thumbs ups or a lot of views does not mean it's accurate. But today we are going to look at MedlinePlus, an excellent free resource for health news and health information. And we can direct our patrons in the library to a more accurate resource for health information and health news. So a little background about MedlinePlus. It's developed by the U.S. National Library of Medicine and the National Institutes of Health. And the National Institutes of Health is located in Bethesda, Maryland. And they're the nation's premier medical research agency with 27 different institutes and centers. And we can all probably name one of the NIH Institute directors, even if we're not aware of it, but Dr. Anthony Fauci is the director of the National Institute of Allergy and Infectious Disease. And the National Library of Medicine is part of the NIH, and that's the world's largest medical library. And when I say that MedlinePlus is a consumer health website, I mean that it's designed for patients and their families and their friends. The content is not written for healthcare professionals. And as far as websites go, MedlinePlus has been around for quite a while. It's been around since 1998. It's free, like I mentioned. It's updated daily, so it's very current information. It's mobile friendly, so you can view it on phones, tablets, laptops, any device. It offers authoritative, reviewed, up-to-date information. The information is easy to read. Like I mentioned, it's in lay terminology. I love that there's no advertising on the site, and MedlinePlus doesn't endorse any company or product. And they follow quality control standards, like making sure their links are up to date, authors are listed, update dates are available. So you can use MedlinePlus to learn about the latest treatments, look up information on a drug or a supplement, and find out the meaning of different medical words. Here's a snapshot of some of the content. There's over 1,000 health topic pages available, and over 700 of those are also available with Spanish content. There's an illustrated medical encyclopedia, and it's pulling together information from over 1,350 organizations. And a lot of those are .govs, a lot of things that the NIH institutes and centers publish, and from professional medical organizations such as the American Academy of Pediatrics. So I am going to go live to MedlinePlus. And the URL is medlineplus.gov, so pretty easy to remember. I'm just taking a quick look at the homepage. In the upper right corner, there's a search box, and that's probably usually where you'll be starting out, but I wanted to browse some of these categories first before running a search, just to give you an overview of the vast amount of information that's available here. So let's start out in the health topics page area. So a little more about what these health topics are. These medical librarians at the National Library of Medicine are selecting and organizing resources and compiling these links into organized pages. They remind me of the print pathfinders of the past that librarians created. So you can go here and read about symptoms, causes, treatment, and prevention for over 1,000 diseases, illnesses, health conditions, and wellness issues. So you can find topics by these different categories: body systems, disorders, health and wellness, or browse the A to Z list.
Roz, can I interrupt for a minute?
Yeah.
I'm not sure we can see your screen. Can anyone else see the screen?
I can see just a MedlinePlus.
Yeah, it didn't click in when you switched to live.
Ooh, okay.
If you might want to reshare with us.
Yes.
Thank you.
Okay, are you guys seeing
We can see it now. Thank you.
Fabulous. Okay, let me just jump back to the home page. So I was pointing out the search box in the upper right and these main categories we're going to take a look at. So I'm going into those health topics, and they cover a really wide range of things, such as diabetes, cancer, mental health, and some things you may not think about going to MedlinePlus for, such as animal bites, hurricane safety. They recently added a health topic page on cleaning and disinfecting and sanitizing. So since so many of us are learning more about that to reduce the spread of COVID-19. So I'm going to go in and pull up an example. I'm going to select blood, heart, and circulation. And then I'm going to scroll down to blood pressure and go to high blood pressure. And so this is one of the health topic pages, and up at the top, it lists the title of the page, but then it'll give synonyms. So words you may hear your healthcare provider use when they're talking about high blood pressure, such as benign essential hypertension. Below that, there's a table of contents of what you'll find on the page, this organized list of links. The summary offers a good introduction to a topic, and this is usually content that's coming directly from the NIH. So below the introduction is the Start Here area, and all these links will open up in a new window. There's a little symbol for NIH, so that lets you know that that's the author, and the author's listed in parentheses. You'll also sometimes come across this green, easy to read icon, and that is identifying materials that the authors have identified as being a low literacy, easy to read document. So if you're working with a patron that might need content at a 5th to 8th grade reading level, you can look out for those contents when you're searching MedlinePlus. And I'll just click on this high blood pressure hypertension from the FDA. So the article's open in a new window, and let's go back down to diagnosis and tests. I'll select blood pressure test, and this is coming from the Mayo Clinic. And scrolling down the page, they have links for prevention, treatment, and therapies. And something I really like about these health topic pages is they cover not only the what is it and what are my treatment options, early questions someone with a diagnosis might have, but they also look on how, try to collect links on, what is it like living with this condition and disease, so more long-term information. So such as the salty stuff, salt, blood pressure, and your health from the NIH. Moving along down the page, I wanted to point out they have a statistics and research area. So if you are working with, let's say, a high school student that's doing a health project, they need to find statistics. The MedlinePlus health topics can be a good resource to show them for getting statistics if they need that for a health project. They usually offer links to clinical trials. And this is another site maintained by the National Library of Medicine. And a little background about clinical trials. They're medical research studies involving human volunteers. And clinical trials look at ways to prevent, diagnose, treat diseases and other health conditions. People may choose to participate in clinical trials in order to receive the newest treatments available. And this is a database that is freely available. You can search to find what studies are out there and who to contact. You'll also see on health topic pages links to journal articles, and these also link to yet another National Library of Medicine database. This is PubMed, and it is the journal article database for the health sciences literature, and they link to freely available journal articles. So some individuals may never want to seek out medical journal articles since these are written for healthcare professionals, but others may not be intimidated by the high reading level and medical terminology. And in some cases, if it's a really rare condition, journal article literature might be the only thing out there on that topic. Towards the bottom of health topic pages, they will pull resources for different age groups, children, teenagers, older adults, also links, content that's specific for women. So again, if you have young adults asking questions in the library related for school projects, MedlinePlus, down towards the bottom of the page is where they'll have the links geared for them and content more at their reading level. So that's an example of one health topic page. I'm going to scroll on back to the top because I wanted to point out how you can toggle back and forth to the Spanish content. So over on the upper right corner, you'll see in orange the link to Espanol. So I will select that, and then it moves over to the MedlinePlus Spanish website. And I love how they have that toggle feature. So if you're working with someone who would prefer to have the content in Spanish, or if that's their primary language, you can see the English version of it before, so you have an idea of what you're directing them to. And then you can toggle back and forth to the English. And then also below some of the links on the English page, you can toggle back and forth from the English to the Spanish version. So I've done a lot of talking about a health topic page, and I wanted to give you guys a moment to go out to MedlinePlus and visit a health topic page and just pick out one of your interests. And let's say we'll give you 2 minutes to do that. And if you want, you can put in the chat box the health topic page that you visited. So the address, let me toggle back, is medlineplus.gov. I can put that in the chat box. So just go to medlineplus.gov, and I'll also put kind of the question over in the chat box, and select an area in the health topics page that you're interested in. Just take a look at one of the pages, trying out some of the links to see what some of the content that's available. It looks like Wendy found the health topic page about spider bites. That does sound interesting. Okay, I hope everybody had a minute to check out a page. I'm gonna go back to sharing my MedlinePlus screen. Oh, looks like Jennifer checked out mental health, Marie, dry mouth. Another person looked at retinal disorders. Okay. So hopefully everybody can see my MedlinePlus screen again. Let me know if you can't. And let's move on and look at the drug and supplement link. So on the drug and supplement information, you can find information about thousands of prescription over-the-counter medications, as well as information about herbs and supplements. We'll take a look at one of the drug resources first, and the drug information is coming from the AHFS Consumer Medication Information, and this is from the American Society of Health System Pharmacists. It's updated monthly. On this page, you can use this alphabetical list to view drugs by their generic or their brand name. I'm going to go to I and look up ibuprofen. So there's a table of contents kind of up at the top of the page, a red box warning for important information. And one of the things I like about the drug information pages is that they're at a much larger font than what I have to look at on some of the different medication boxes. So easier to read. So it talks about why is this medication prescribed? How should it be used? What special precautions? What should I do if I forget a dose? Possible side effects. What are some of the brand names it goes by? And down at the bottom, it gives us a date of when this page was last revised. And now let me scroll back up to the top and let's take a look at one of the supplements. So the information on the herbs and supplements area is going to come from one of two sources, either the Natural Medicines Comprehensive Database, which is updated quarterly, or from one of the NIH institutes, the National Center for Complementary and Integrative Health. And you may get questions in your library from folks who are looking for cheaper alternatives to prescription medications to try out. But as many of us know, that these supplements can be ineffective, and they can also be potentially dangerous or interact with other medications. So this can be a good place to steer folks to learn more about safety information related to supplements or things they might have read about as an alternative treatment. And again, we can use this A to Z list to browse. I'm going to go to cinnamon under C because I have a friend with diabetes who takes cinnamon to help control her blood sugar. So here is the cinnamon page, and it talks about potential uses that people do. And it also tries to summarize in easier to understand language, what evidence out there, is supporting the use of this. And usually there's usually not a lot, and it's trying to weigh, how dangerous is this? How useful is it? How well what was the quality of the study designs? So it's talking about safety issues. And then down towards the bottom, they will give references of these resources these studies that they're summarizing. So those are some examples of what you can find under the drug and supplements area. And I've got another practice question for you guys to try out. Let me copy and paste it in the chat. Okay, so I'd like you to go to the drug and supplements area on MedlinePlus and see if you can find what shark cartilage extract is most famously used for. And after you find the answer, you can go ahead and put that in the chat. I'll give you guys about a minute or so to try that out.
Oops, I lost the whole thing.
Okay, I think I saw the answers coming in. So yeah, cancer was what I found as well. So I went to the herbs and supplements area, and S for shark cartilage. And up at the top under what is it, it says shark cartilage is most famously used for cancer. Well, let's move on to another one of these areas, and let's check out genetics. And this genetic content comes from Genetics Home Reference, which used to be a standalone National Library of Medicine website, but they recently bundled it into MedlinePlus, and I think they're decommissioning the Genetics Home Reference standalone site on tomorrow, on October 1st. So here you can learn about different genetic conditions, genes, and chromosomes. And there's this useful Help Me Understand Genetics handbook. And all this content is reviewed by experts from the worldwide scientific community before posting. And with each review that comes out, it's reviewed again by them. And genetic testing has become a hot topic with the increasing availability of genetic testing from healthcare providers, as well as the rise of those direct-to-consumer genetic testing options, such as 23andMe and Ancestry DNA. So you may be getting questions like that in your library. So let's look at some of the kind of content that's available. And I'm going to go to genetic conditions. And then I'm going to go to W and look at Wagner syndrome. So whenever you see the camera icon next to a hyperlink, that's going to be a pop-up image that you can view. And on these condition pages, they have the content collapse, so you just expand them to see the different content areas. So this is a pretty rare disorder. About half of the people that are affected by it are from the Netherlands. And down towards the bottom, they list their references that they're citing. Let's also take a look at an example of the chromosome information. And let's see, let's take a look at chromosome 21. So it gives a description, and then the pop-up information again. You can view health conditions related to chromosomal changes on chromosome 21. And they got their references that you can look at as well. Also on that genetics page is that Help Me Understand Genetics handbook. And they describe it as an introduction to human genetics, and has basic explanations of genetic concepts. So let's say you had a patron coming in that was interested in direct-to-consumer genetic testing. Go there. And here it has different questions, such as, how do I choose a direct-to-consumer genetic testing company? So on that page, you've got questions to read through to help evaluate those different companies that are out there. So that's some of the content available on the genetics page, and I've got a practice question for that as well. Okay, so if you go to the genetics area and find the cyclic vomiting syndrome. So if the condition's not treated, episodes usually occur how many times per year? Okay, I'm seeing some of the answers coming in. That, yeah, it can occur 4 to 12 times per year. So to find that answer, we went to genetic conditions and then see, and pardon my scrolling because I got to get down to the bottom of the page for the cyclic vomiting syndrome. There it is. And in the description at the beginning, the condition's not treated. Episodes usually occur 4 to 12 times per year. Okay, under the medical tests area, you can learn about medical tests, what the tests are used for, why a doctor may order a test, what to anticipate, and how to help interpret the results. And I'm not, I usually have to read things. I'm not a very good auditory learner, so if I hear from a nurse or my doctor about a test that I have to take, if they don't give me written information about it, I usually, jot it down while I'm in their office and then come home and check out MedlinePlus to see if I can learn more about the procedure. Recently, my husband was having some pain in his arm, and we learned that he needed to have a nerve conduction study. So we visited MedlinePlus, and I found out that that's called an electromyography. And so I'll pull up an example, that example of a test description. So it gives a description what they're used for, what can I expect during a nerve conduction study, any risks, what are some of the possible conditions, what are the information that the doctor might be trying to gain from conducting that test. And then you could expand the references if you wanted. So I think this is my last practice question I've got for you guys in the medical tests area. Let me put that in to the chat. So go to the MedlinePlus medical tests area and see if you can find what a C-peptide test is used for. Okay, I see a lot of you finding the answer, so I'm going to pull it up as well. So I'm going to the C-peptide test, and it's often used to help tell the difference between type 1 and type 2 diabetes. The final browsing area up at the top navigation of MedlinePlus is the videos and tools area, and that's probably the part of the site that I use the least. But there are health videos, health check tools, games, to learn more, to improve one's health information literacy. There is an understanding medical words tutorial and evaluating health information tutorial, which are both really good resources. I'll show an example of one of the health check tools. And I'll just select the first link, do you need a hearing test? And here's a short list of questions one can go through when they're wondering if they need to go get their ears checked. And at the bottom of the page, it says where they're adapting this information, what test this is coming from, and the most recent update date. Okay, so back on the MedlinePlus homepage, you can also, we've just been doing a lot of browsing, but if I wanted to run a search in MedlinePlus, I'll show you what that looks like, and I'll do a search for COVID-19. And over on the left-hand side of the results, it'll pull out the different browsing areas that we looked at and the number of results within that topic area. But on the right, on the results, if they have a health topic link available for your search topic, that's going to be the very first link listed. So there is one for COVID-19. I also wanted to mention you can do phrase searching. So if I wanted to do peanut allergy and put quotes around it, so it's going to give me results that have both of those words next to each other. There's a food allergy health topic page, but there isn't one solely on peanut allergy. So the first couple of links are for individual websites that they link out to that cover peanut allergy information. So that's kind of what the search results page will look like when you're running a search in MedlinePlus. A few more content areas I wanted to point out. We looked at the topics going along the top, and they kind of repeat over here on the left sidebar, but they add a couple of new ones, such as the medical encyclopedia that you can use, and that comes from the ADAM medical encyclopedia that they license information from. And they also have healthy recipes that they link to. It says up here at the top of the page, as many of us know, staying healthy can be a challenge. Like eating healthy meals and being physically active can help out a lot. And that research shows that these changes can help you maintain a healthy body weight and reduce the risk of chronic disease. So they have them organized by different meals. We just pop in and look at side dishes. It will link to any NIH recipes, like from their Heart, Lung, and Blood Institute, and they also link out to this foodhero.org website quite a bit. So I wanted to point out those areas to you. And we talked a little bit about the easy to read materials that they have, what that icon looks like when you're within a health topic page, but down at the bottom of the page, if you just wanted to view what they have available in that category, you can do that at the bottom of the page. So it's also an A to Z browsing list. So if I go to under alcohol, alcohol and medicine interactions, it's pulling up content from the NIH. And the authors of the content, not the National Library of Medicine, identifies the content as being lower literacy levels, so between a 5th and 8th grade reading level. So it's the authors that are determining that. And we talked about the Espanol, the Spanish toggle to look for on the right-hand side of MedlinePlus, but they also have content in a wide variety of languages. So also down at the very bottom of the page, there's the health information in multiple languages area. So they have content in Arabic, Bosnian. I think I went to German. And just like we saw with Spanish, they'll give us a link to what that content is in English, and then in this case, what the German version looks like. So here is the German. So I just love that feature, being able to see it in English before sharing that information with the patron, because I'm not bilingual. Also down at the bottom of the homepage, you know, if you get questions about finding healthcare services in your county or your region, they have a list of organizations and directories down at the bottom that I wanted to point out. So let's say, you know, a patron is looking for a gastroenterologist in their area. You could go to directories, and then under specialists, there's a find a gastroenterologist option from the American College of Gastroenterology. And I'm just going to plug in a Columbia zip code and run a search, and it pulled up 18 results of different specialists. So those directories are available. So as you can see, there's quite a bit of content that's available for free on MedlinePlus with no advertising and good quality control. They do have a couple of publications I could point out to you. On the right-hand side, there's this option to sign up for the My MedlinePlus newsletter. And this is a weekly email newsletter that they send out that will give summaries on different health topics from the NIH, and they also include a healthy recipe each week. They also have this NIH MedlinePlus magazine, and that's available electronically as well as in print. So it'll have latest research summaries from NIH, as well as kind of some celebrity health condition stories that are out there. And I wanted to mention that if you're interested, you know, if you have a pamphlet display in your library when libraries are open again, if you're not yet, you can request to get the MedlinePlus magazine for free in bulk. And I got a link that I can put in the chat box if you want to request the magazine. It's just an online form you can fill out. And we have some in our library, and also, you know, seen it in some doctors' offices. And I think at this point I have covered a lot of what's available on MedlinePlus. And we do have a few minutes left if you guys have any questions that you have about the website.
I don't have a question, but I like this a lot. It's really helpful.
Great, Roberta, thank you. I'm so glad to hear that.
Awesome. Thank you, Roz, very much. Yeah, this is one of my favorite websites since Roz introduced it to us last year. It's something that I've used a lot in, you know, in my own life and a couple of the online health literacy courses that I've taken. It's really, really good. And as I stated in the chat, it's kind of just the beginning. It's one of the largest databases from NIH/NNLM, but we're going to be looking at quite a few that are all equally helpful, reliable, great graphics, good information, easy to translate into Spanish, easy to look for some of those lower literacy options. So right up our alley for some of the projects that we're working on. All right, I am going to turn off the recording.